Hey guys, welcome to another session of Veda Victory and I'm Nandita Arora and let's finish today. Hepatomegaly. Now how we can differentiate the congestive hepatomegaly from simple hepatomegaly? The word itself says that congestive means something related to Dil. Now something related to heart. We have to imagine a person that is right in front of us and we have to see his three things. First is foot, second is the abdominal region and third is the heart. Now foot, we will see pedal edema in this case. Second, abdominal region, we will see dyspepsia. When we'll take the history of the patient will say कि कुछ खाने का मन नहीं करता, कुछ मैं थोड़ा सा खाता हूँ मेरा पेट भर जाता है. That is called as dyspepsia. Something bloating, something gasiness in the stomach. That is dyspepsia. And second, in some cases, jaundice will also be there. That can be diagnosed by bilirubin levels. And third thing, that is heart. So some cardiac lesions will also be found in the case of congestive hepatomegaly. So these are the three things that help us to differentiate it from simple hepatomegaly. Congratulations, now we have reached to amyloidosis. Why I said this will be revealed a minute later. Now amyloidosis, as you all know and discussed in previous lectures, that it is the accumulation of the excess amyloid protein in the vital organs of the body like liver, spleen, kidney, etc. Now, two important things that happens in amyloidosis is albuminuria and congratulations, that is Congo red test. Now, albuminuria is the excess of albumin in the urine. Presence of albumin in the urine is called as albuminuria. Now, what is the normal level of albumin in the urine is less than 20 mg per dl. And when this level exceeds the normal limits, it is called as albuminuria test positive for amyloidosis. And the second is Congo red test, that is congratulations. Now, Congo red test is basically a type of similar to cotton dye test. A sample is taken and in that Congo red dye is put. And after that, after some time, 10 to 15 minutes, that sample is observed and this Congo red dye test is said to be positive if we see red-green birefringence. So these things indicates that the Congo red test is positive and the patient is having amyloidosis. And when we have diagnosed that the patient is having amyloidosis, that means the primary cause is this and the secondary is hepatomegaly. So now let's talk about malaria, that is malaria, and how we can differentiate this malaria from hepatomegaly. Now we know that a patient who is suffering from malaria will feel fever, he will feel rigors, he will feel chills, the fever will be high, he will have sweating, he will be very weak, he will experience anemia and all these associated symptoms. But what are the peculiar features that will differentiate it from hepatomegaly? That is, in first, how we can diagnose it that it is malaria? By fever. The amount of fever will be high, but it will decrease with the amount of sweat. That is, the sweat will be inversely proportional to the degree of fever in case of malaria. And second thing will be, there will be paroxysm of the fever. That is, the fever will not be consistent. It will not be regular. It will be reoccurring. That is, there will be paroxysm of the fever from every 48 to 72 hours, the fever will reoccur. So this is a major sign. And obviously the blood culture test will help us to detect the malaria and its organisms. So we can find that the primary cause is malaria and the secondary cause is hepatomegaly. Now let's move on to hydatid cyst. Now what is this disease? How we can differentiate it and what are their peculiar features? Naam se bahut badi lag rahi hai, but it is very simple to diagnose. First of all, this is the only disease in which the patient will not feel any liver tenderness, no splenomegaly, no jaundice, no liver tenderness, no pain. Two things that are very peculiar and will help us to diagnose it are urticaria and Kisoni's test. Urticaria is basically a skin infection. As we all know, there will be some skin patches on the skin and that will help us in some cases to diagnose that it is hydatid cyst. And the second sure shot in 99.9% cases, it is positive and specific for hydatid cyst, is Cassoni's test. Now this is very interesting. What happens in Cassoni's test, I tell you that in Cassoni's test, the patient is injected in one arm by the Cassoni's fluid, and the same amount of Cassoni's fluid, the amount that we have taken, the same amount of NaCl is injected in the other arm so as to prevent the reaction in the body. I repeat, the same amount of NaCl is injected in the other arm. Now, the patient is observed for 30 minutes. After 30 minutes, in that arm in which the Cassoni's fluid was injected, that arm is observed for any flare, for any wheal, for any redness. And if that is present, that is said to be positive Cassoni's test. And that is the sure shot examination for hydatid cyst. And that is the reason this is the main diagnosis, and we can have a conclusion that the patient is having hydatid cyst, and that is the reason for hepatomegaly. But remember, there will be no splenomegaly, no liver tenderness, no jaundice, no pain. He'll be very cool and calm. So that was all about hepatomegaly. I hope that you have understood it and you have grasped the knowledge of hepatomegaly. And thank you guys for supporting me and sending me feedbacks, whether it was positive, whether it is negative. I welcome all the feedbacks wholeheartedly. Keep supporting me like this. Thank you so much. We'll come again with some interesting topics. Stay tuned.